I won't be able to with you here. Okay, Tracy.
Oh, we're on. Hello, everyone. Welcome to the LGBTQ Voice. I am Tracy Welch, alongside Eileen Dugas.
Hi, everyone. My name is Eileen Dugas. I'm the network coordinator for the South Coast LGBTQ+ network. This show is presented by the network. We're a nonprofit organization working with LGBTQ+ groups and allied organizations to build and maintain a comprehensive network for LGBTQ individuals and families in Southeastern Massachusetts. Today, we're going to talk about who and what is the South Coast LGBTQ network. We haven't been on for a while. Last week was our first week back, so we're going to let people know who we are and what we do. And we're going to just reach out and say, hey, how is everyone doing during these times? Today, our stay-at-home order was extended, I think, until May 18th. So we can talk a little bit about that. We have a guest tonight, Marlyn Barros, and we'll meet and talk with him about what he's doing in the community. And at the end of the show, we'll share some resources available and some upcoming events. Tracy's going to give us a little description now about the history of the network and how it all got started.
Thanks, Eileen. So a little over 6 years ago, a bunch of us got together in the community that were grant writing for the Lipsky Whitaker Fund. It was like the women's, the WYCA, UMass has a Dartmouth, UMass Dartmouth has a women's gender studies group, Fairhaven Council on Aging, or NB Agley, South Coast Equality. There was many other groups and organizations that were taking the money, it was depleting. So Liz DiCarlo and Bev said, well, why don't you guys form some sort of group? And at the time, we didn't know what that meant or what that would look like. So we actually met at the Fairhaven Council on Aging. We brought our youth from NB Agley, which is the Bedford Alliance of Gay and Lesbian Youth, which I'm one of the advisors for. And just kind of wanted to make sure that we had the youth perspective, we had the seniors perspective, the wise perspective, South Coast Equality, everybody say, what can we do? How can we form something, and what will we call it? So we all got together, and it was an amazing conversation. We ended up calling ourselves the South Coast LGBTQ Network, and network for short. So if you see us out and about the community, we'll say it's the network. We formed our bylaws, our rules, our regulations. We borrowed from the community. We actually outreached and said, okay, what are other people doing? And we actually adopted some, changed some, and before we South Coast LGBTQ Network. In 2017, we actually got a 501c3 status. So we're not longer who we used to be without a member organization. We actually now have board members, and Marlyn actually just joined recently as well. So congratulations to Marlyn, which is amazing. When we joined the network, we just thought, how could we bring the community together? What is it that we're looking for? We wanted to work collaboratively to eliminate homophobia in our communities through education, advocacy, and community outreach. Advocate, support, and provide programs that ensure the safety and well-being of LGBTQ individuals, such as housing, education, employment, mental and physical health. That's one of the reasons I'm glad that we started the LGBTQ Voice, to kind of give you guys, a wider perspective of what's going on. Sure, you can see us on Facebook, you can check our website out, but to have these live guests talk about communication, healthy relationships, domestic violence, what's going on at the health center, provide a central hub for the exchange of ideas, resources, and programs, in collaboration to ensure that we're treated with respect and dignity and equality. That's one of the the reasons I jumped on ship was I wanted to make sure that we had something to sustain us in our future. And we're going on 6 years right now. And it's just amazing that we took over South Coast Pride, which was from South Coast Equality, and it was formerly New Bedford Pride. So each year we grow, we add more to our repertoire, if you want to call it that, and we actually have different committees that folks can join. I'm also the events committee chairperson and secretary of the network. We actually have volunteers for social justice and development and fundraising. So we're going to need a lot more help in the community, especially to come out of this COVID-19 and get to where we want to be and get back to where we were on our status in the community. So we want to keep that going. But if you guys have questions about the network, you can email Eileen and myself. We're at, EIL, sorry, EN at southcoastlgbtq.org, or Tracy, TRECI at SCLGBTQ.org. And hopefully we'll be able to put that up in our headers from now on, so we won't have to keep saying it over and over again. But I'm going to give the mic back to Eileen and introduce the next guest. Eileen? Oh, I think Eileen froze for a minute. Marlyn, is there?
I'm here.
Okay, well, every now and then one of us will freeze. So Eileen will be back in a minute. So I will introduce Marlyn. You work for where? What you do?
I work at the Greater New Bedford Community Health Center. I am a community health worker there, and I also sit on the advisory board for the Massachusetts Community Health Workers Organization.
Oh, great. Eileen,
also called MASHWA.
Yep, I just introduced him. You zipped out, so go ahead.
Hi, I'm back.
Yeah.
So Marlyn, tell us a little bit about what life is like right now at the Community Health Center. What does that look like?
It looks very different from what it used to look like, obviously, everything that's going on. We have condensed the health center to basically 2 departments, because before there were several departments, which were women's health, pediatrics, urgent care, infectious disease, and adult medicine. Now we have basically 2 departments. So the urgent care was transformed into the respiratory clinic. And those are people that are coming in being tested for COVID-19. We also have the regular scheduled appointments, excuse me, that are, they moved that into women's health. So all regular face-to-face appointments and urgent care visits that are not respiratory related are in the women's health department. But for the most part, the providers have switched to the telehealth system, which is just keeping a lot of people safe, keeping people at home, and not trying to minimize the volume of people coming into the health center for everyone's safety.
Yeah, so people are basically coming in if they are having concerns or symptoms of COVID-19, and
Yes.
everyone else is being seen through telehealth, basically?
Telehealth, yes.
So what about,
I mean, there are some appointments that still need to be seen, like people have to come in for lab work, get blood work drawn, and what have you. However, if the provider is able to schedule a telehealth visit as opposed to having patients come in, that's what they're doing.
I'm sure, yeah, for everyone's safety. How does the beginning of your day go? What does it look like when people come into work? Are people being screened before they enter?
Oh, yes. So we have split up shifts where we work 2 hours on, and this week it's changed to 1 hour on, 1 hour off. But we have one main door now. People, staff, and patients are only allowed to come in through one door. It's the main door, which was the urgent care door. The urgent care door on Purchase Street. And when you walk in, we have, as you can see, everywhere else has the tape, the 6 foot distant tape, if there is a line. And in the morning time, there is a line. People are coming in to get tested. We're seeing a lot of people coming in now. The volume is getting higher for people coming to get tested for the COVID-19. You come in and you're asked the questions right away. Do you have a fever or cough? You have to sanitize your hands. We have a hand sanitizer dispenser right at the door. This sanitize your hands. People come in with gloves. They have to take the gloves off because gloves are already contaminated. You're touching things on the outside. Mm-hmm. So we have to have them take the gloves off, sanitize their hands. They're allowed to wear masks in. We ask them if they have a fever or a cough or shortness of breath, any of the symptoms of COVID-19. A lot of people will say that they do. We take their temperature immediately. Even staff, we're getting our temperatures taken as soon as we walk into work.
Yeah, that's a huge transition, moving from walking into work and then each person being screened. It must be quite a process yes. For both employees, staff, and also if someone's coming in for lab work, right? They still have to have the screening. So that's a huge transition for you. Before I ask my next question, I want to check in with the people who are commenting and let you know if you have any questions for Marlyn, you can type them in the comment section and we will be reading them live and we can ask him some questions. Cece Marie from Hyannis, hi. Nate Mendez is here. Hi, Nate. I'm glad you're doing well. Monique is here. Alan from Wareham. Pamela from Fall River. Stephanie. Let's see. Makaruda. Let's see. Becky, Brenda. So we have a lot of people who are saying hello. Amber says hello. Linda Spinner says hello. Hello, Linda.
Hi, Linda.
Yeah, we miss you too, Linda, definitely.
Let's see. Someone said we love Greater New Bedford Community Health Center, but I can't find who said it. Oh, here it is, Stephanie. Stephanie said she loves the health center, so I just wanted to say hi to everyone who's watching, and thank you.
I like when people tell us where they're from. I think that's amazing. Remember last year somebody tuned in from Puerto Rico? That was pretty cool.
Yeah. Hi, Heather. Hi, Wendy. I'm glad you're here with us. We're, in case you just joined us, we're talking to Marlyn Barros, who works at the Greater New Bedford Community Health Center. So he has talked to us a little bit about what it looks like day to day there. I have a few other questions. Are you still doing HIV testing, or where can people go for that testing if they need that testing?
We are doing the testing still.
Oh, you are?
That is still
Is it by
appointment? Yes.
Okay.
I mean, people are walking in. People walk in. You can walk in and just say you're here for testing, and you will get brought to the designated area that you get tested at. It's a different flow than it used to be, where the infectious disease was the base of where you do the testing. Now, because the infectious disease department, along with other departments, are closed, they're centralizing everything in one of the departments for face-to-face visits.
Marlyn, can you tell us like the hours and the days that you guys are open there?
The hours have changed, so we're no longer open at 7 a.m. like we were previously. It is now 8:30 a.m. to 5:30 p.m.
And which days of the week?
Monday through Saturday.
Monday through Saturday.
Sorry.
No, I
also forgot pediatrics is open as well. I didn't realize. I forgot that I didn't say pediatrics. Pediatrics is still open, so children are still being seen as well.
Oh, that's good. So I actually have a bigger question, I guess. So when this is all said and done and we're all back to normal, what do you think you guys will take out of this that, you know what, we can have people just consult online and not have people come in? Is that something that you guys will thinking about? Are you guys like writing notes now? You know, what can we do now, you know, if this ever happens again, or what can we continue to do now to make it better for the future?
Well, there's new developments every day. So literally we joke, the staff that is there, like, okay, we go into work like, okay, what do we have in store for today? What changes are going to be made today? So it's still evolving every day, every week. It's something new, something different. And for me, I just roll with the punches. I try to see the bright side of everything and look at it as, you know, it could be worse. So, you know, we just roll with it. I try not to be negative and concentrate or focus on what we can't do or what's different, and realize, okay, we're still able to do this. I'm still able to do that. You know, we're healthy. So let's just count our blessings.
That's one of the things I love about you.
So, Marlyn, my next question is: how is the medical team and the professionals in your at the Greater New Bedford Community Health Center? How are you keeping yourself safe? How is the PPE? Is it available to you? Is there a shortage? What does that look like for you?
Well, we all have masks. We are supposed to wear our masks everywhere. If we are not dealing with patients or we have no reason to be on the floor, the respiratory clinic, which is the urgent care, we really should stay in our designated areas or our offices if we have no reason to be there. Because I am working the door in shifts, we do have our own PPE equipment. I have my own, we all have our own, and they get swapped out each week, every 3 days actually. So I have a gown, I have the mask on top of the big visor and shield, and gloves.
I have seen some pictures of you in that attire.
Yes. Masked
So
up, yes.
I'm glad that you all have the appropriate protective equipment and that it's available to you. There's not a shortage. So that's amazing, because as you know, across the country, we have been hearing that for weeks, a shortage. So I'm glad that's not an issue there.
Yeah.
Can you talk at all about what happens when someone comes in with symptoms of COVID-19? Do they stay there? Do they test? Do they get sent home?
We're seeing a lot of people coming in now. As you know, New Bedford is now it's becoming a hot spot, or it's finally hitting us now. This is the surge. So we're seeing a lot of people come in. I'm seeing a lot of people come in because I don't work the door in the morning. I'm not dealing with the rush, the crowd that's waiting outside in line. But people are coming in and they are being seen. We have a designated spot, so people are coming in and they're told to call first. So a lot of people will call in first, and we're already aware that they're coming in. So what we do is I ask the same questions: fever or cough, do you have an appointment? My first initial question to everybody, because we're working together to try to minimize the volume of people in there. So the first question, as soon as somebody walks in the door, is, do you have an appointment? A lot of people will say, I called and I'm getting tested. So they're already expected. I take their temperature, tell them to remove their gloves if they have gloves on, sanitize their hands, send them over to the designated spot where people the patients register to get tested for COVID. And we have a designated area in the urgent care that is set up just for people that are getting tested for COVID.
Do you have some questions, Eileen?
Yeah, I do. I have some more questions. So
I meant the comments online. Sorry.
Yes. Yep, definitely. So they're asking, have you seen a drop in numbers? Do you have any statistics around that?
Well, as of last week, I had the day off yesterday, so I didn't really check. But as of last week, we had 66. The Monday of last week, we had tested 60. I'm not sure the numbers of tests we did, but we had 66 positive COVID-19 cases, and that was as of Monday of last week.
Okay. Someone's asking about hair salons and how are we going to stay 6 feet away? That's a great question. I definitely need a haircut. So I don't know. I think that's something we'll see in the next few weeks. Let's see. Is COVID-19 test literally asking people if they have a cough and taking their temperature? What other procedures? I think you spoke to that a little bit, that there's testing for it. That's the screening process, Marlyn, for when they come in. You ask about a temperature and a cough,
Yes,
but if they
exactly.
answer that.
Yes, and if they have the symptoms, we're testing a lot of people. And the health center was one of the designated testing sites as of last week. Our CEO was interviewed on Channel 10 last week. It might have been Wednesday, I believe. But the governor had given tests to certain test sites in this area of the South Coast in New Bedford. We are the designated testing site, so we're going to see a lot more people coming in for testing, whether they're patients of the health center or not.
Definitely. And how are you taking care of yourself, Marlyn, during this time? I'm sure things have changed and got a little more hectic for you. So how are you taking care of yourself?
I just look forward to relaxing when I get home. And even though you're the shelter in place and you stay home, I mean, I have my family. I went on a ride this week with my son and family to just take a ride to Newport. We got out the car. I mean, we're breathing fresh air. We're not going into stores. We're not going into places. It's just getting out, even on a daily basis, because my son is home on a daily basis now. I try to come home from work, and even though I want to be home, bring him out, take him out for a ride, even if we're just riding around the city. Go do something just to get him out of the house. For myself, I learned early on that when I was watching the news morning and night, it was putting me in a bad headspace. So the morning news is basically what I will watch, and we don't watch the 6 o'clock news. And I realize when I go to work, I'm going to get the pertinent information because I work in a healthcare facility. So I don't need to saturate myself with the news and all the negativity or worries.
I'm glad you have a plan and you've realized what adjustments you need to make to take care of you and your family. So I'm thankful, because some people get lost in that process and that routine and they can't get out of it. So good for you for recognizing that. I want to reach out to a few more people who have commented. Let's see. Hi, Kate. How are you? Hi, Mike. Hi, Darlene. I miss you too. I hope things are well. Wendy Hiller had a comment. I think coming out of this pandemic, there will be much more teledoc visits with video use for a lot of things compared to previously used. Technology has shown to be very successful in being able to handle these visits, as the camera allows views of things and such. Have had several teledoc visits throughout this pandemic that have been successful. So
that's great. Well, one of the things we're talking about, so we're talking about COVID-19. Mass Equality has a Facebook page, and they actually have a COVID-19 LGBTQ plus community needs assessment to help gather data so they can focus on the most crucial areas of needs in the coming weeks. By filling the survey, you can help them fight this crisis by providing critical data on how the pandemic is impacting the LGBT plus people in Massachusetts. With your help, they can advocate for our community effectively so that the disease does not, I'm going to say it wrong, sorry, exasperate, thank you, existing inequities. It's only a 10-minute survey, so you can get info at massequality.org, or you can get their Facebook page, just Mass Equality, and get that done. Obviously, this is the LGBTQ voice, and there are statistics for all of Massachusetts, but we're looking for more of a broad, way to view LGBTQ, because last week's show we talked about some of the issues that impact the LGBTQ plus community being at a higher risk because of HIV, low immune system, things like that, smoking, and whatnot. So I wanted to make sure while we were talking with Marlyn, to let people know for the LGBTQ plus community that is available.
thank you, Tracy. Hi, Jennifer. I miss you too. I hope you're well. We have a lot of new viewers tonight, which is awesome. So Eric Richard, Marlyn, I don't know if you can speak to this or not. He just said, he's saying that you said there were 66 new cases. He saw a post saying there was 66 new cases at Brandon Woods. So I'm not sure. He's asking if the test if you did the test there or somewhere else. So I guess for clarification.
Sorry.
Go ahead.
I was speaking on the information that we received at work last Monday. So that was what we tested. I can't attest to who tested at Brandon Woods. I can only attest to the numbers that we have at the health center that we're aware of.
So just you're on site, not somebody else is on site.
Yeah.
Right. So as of Monday, the Greater New Bedford Community Health Center had a total of 66 positive cases that you have tested thus far.
That was then, and a whole week has gone by, and now we're on a new week. So, and because of the volume of people coming in to get tested, I know the numbers are a lot higher now, obviously.
Right. So, Eric, just for clarification, he's speaking of at his workplace, not for the city of New Bedford total or for the state of Massachusetts total. He's just talking about numbers that he had from the Greater New Bedford Community Health Center. Tracy, did you have something? I think I interrupted you.
No, go ahead. I just saw that Mike posted up, New Bedford guy just posted the new statistics and whatnot. What I was going to say is the mayor just moved us to opening the city again until, was it May 18th, I believe?
Yes.
And it's true, we need to. And I know people are going to get mad at me. And again, people, when are we going to have our next tea dance? We're not. We want to be safe and part, right, Marlyn? We'd love to get our groove on, right? But we have to be safe, people. And if it means, it's beginning of June and we're starting to, 8 people, 10 people out and things like that, then so be it. But we need to be more safe.
This is really, for me, this has been an experience to think outside the box of normality. I mean, we have I have a network of friends, obviously, and family. We have virtual drink night, and we're in our own homes having drinks. Meet up at parks. I've seen other friends of mine where they're all in their car. They'll meet in a big parking lot before they close the parking lots, and they're just all sitting far away from each other, social distancing, of course, and spending time together far apart.
Or how about on Facebook? I believe it was like a blind date that somebody set them up on, and you can't go out. So what they did is they had the same meal. I'm at my house, your house, and they FaceTime each other, and they had a dinner date, just like that. So I think we're thinking outside the box, what we can do. I think going further, we'll find more statistics, what's going on. But I'm so glad that you're safe, that you've joined the network, Marlyn. I think that the network where we're going is going to take us, to that next step of what we're looking for. And you're the piece of that pie we were missing, baby.
Definitely. Marlyn, before we close out, is there anything else that you would want to talk about or advice you'd like to give to the community? Anything that you would like to add?
Only thing I will say and urge people is just it can be frustrating, especially mental health wise. It can be really frustrating being quarantined and having to stay in the house and not having the usual outlets that people have, especially people who struggle with mental health issues or mental health disabilities.
And waiting in line.
So I would say, just realize that you're not stuck at home. It's safe to be at home. And with that said, find things that you might not have normally done before this happens to keep yourself occupied and entertained. Think outside the box. Don't be afraid to think outside the box and throw ideas out to family members or friends to be able to lift yourself up and have a good time in this time of quarantine or while all the stores are closed or what have you.
Definitely. Thank you for that, Marlyn. Tracy, do you want to talk a little bit about what's coming up in the community?
Yep. So we talked about it last week, the new movie on Netflix, tomorrow night at 8:30. We're actually going to, Eileen's working on it right now with Carrie. We're going to do like a Zoom call in about a week and a half, give people time to watch it. It's 2 lives, 1 secret, 7 decades together. It's called A Secret Love. Terry Donahue was on the All-American Girls Baseball League. She fell in love with a beautiful woman in 1947, Pat Henshaw. And they passed for decades. People thought they were friends, thought they were cousins, and they finally came out. And there's a movie on Netflix, and it starts at 8:30 tomorrow night. We just thought, since we're doing a lot of virtual stuff right now, it'd be great if everybody could take the time this week to kind of watch that movie and then come back and kind of talk about it. And of course, we missed the Winter Film Series. This would be a great film to have next year. And I know that we have a guest coming up to talk about this movie in 2 weeks, right, Eileen?
Yeah, so we will have May 11th. We'll do our little kind of movie review, talk about the movie May 11th at 7. Tracy, I just sent it to you. So the event, I'm sure, will be up tonight. Tracy's quick like that. May 11th at 7. I will get a registration link for you so you can link to it, and then I will send you a Zoom link so you can log in on that night, May 11th at 7 p.m. And on May 12th, we will have Paula Schneider from Coastline Elderly Services. She's going to come on and she's going to talk to us about how COVID-19 has impacted the LGBTQ seniors in our community, in our area, and also talk a little bit about this movie once we all get to watch it. So that will be on the 12th.
So someone's asking what the name of the movie is again, and it's called A Secret Love. And then actually, if you've seen the movie A League of Their Own, they were there. They were there. Terry was there then. She's one of the people that are, in the pictures from, years back when the All-American Girls Baseball League had started. I can't wait to see it. Somebody just asked about they don't have Netflix, so hopefully, Wendy, it'll be somewhere else again. I want to give a couple of shout outs today. So Rhode Island Pride has been working really hard with the LGBTQ plus and they've been doing a food bank. So if you guys can hit up Rhode Island Pride's Facebook page, see if you can help with donations and whatnot. It's been amazing what they've been able to do. Also, there's free tutoring through grades K through 12 from students, 5,000 students from Brown, Harvard, MIT, and URI students at gopeer.org. And they're giving free tutoring to kids that need it. Because like I said, our kids, I'm sorry, the new math, I'm like, what? I just think it's amazing that these kids have an opportunity to get tutored. And then one more big thing, our NB Agley Youth Group, the Bedford Alliance of Gay and Lesbian Youth. We usually meet Thursdays from 5 to 7. And it's kids from the South Coast, LGBTQ plus, ages 14 to 24. We help empower them, support them in the community. We haven't been able to meet. So we actually have been doing a Zoom call. So if you are in that age group and you got to join the page, because it's actually a private page. So we actually do the research to make sure the kids are on the page or actually kids in the LGBT community in that age group. It's NB Agley, a perfect place. If you want to know more about the kids, we actually have an adult page, NB Agley Allies of a Perfect Place. Some of these kids aren't out. They're closeted. So we want to make sure that we're trying to keep them, as safe as possible. So I want to kind of give you guys some news about NB Agley again. So we're Thursdays from 5 to 7. And the movie tomorrow night, I will definitely be watching Netflix tomorrow night. I got 2 kids, and I'm hoping that, but I have 3 now. My son, I don't forget him, he's 33. But 2 foster kids. So hopefully, we'll be able to kind of watch it as a family. And yeah, I think that's all. Eileen, you want to?
I have one more. Friday night, we're going to have bingos. The event should be up. I'm waiting for the link, but it should be up for registration by tomorrow night, the latest. The first 25 registrants will get bingo cards. It's free. It's going to be just an opportunity for us to get together, have a little bit of fun. There will be a few prizes that I will mail to you. So please look out for that link. And if you want to play bingo, register. And if it goes well and I can manage 25 well, the next time we do it, we'll increase the number. I just want to make sure that it's a good experience with 25 before I go bigger than that. So if you have questions about that, you can email me, Eileen at sclgbtqnetwork.org, and I'll be more than happy to get you information.
Too funny. You wanna? Next line's yours.
Yeah, I think that's all I have for tonight. Gracie, do you have anything else?
Yeah, I just want to make sure everybody tunes in next week. We're going to introduce you guys to Kerry. Kerry Zeta is one of our newest board members. He's been working on behind the scenes. He's a marketing guru, if you want to call it that. I actually don't know what his main job in real life is. But if you guys have seen, we have our new LGBTQ voice logo that he helped design and redesign, and redesign the South Coast LGBTQ network logo. Him and Eileen have been working on the website. We're going to let you guys know what's been going on with that. And we just thought we'd kind of take a break and fill you guys in about the website and maybe some news. And just we'll have some more ideas of the virtual events. If you guys have a virtual book that you guys want to kind of say, hey, it's going to be a great book for people to read, and we can do like a virtual group afterwards. Hit up Eileen. We've already reached out to a couple people in our community. And that will be coming up as well in the community. So we'll definitely see you guys next week. Take care.
Have a good night. Thank you, everyone.
Thanks for having me. Have a great weekend. Good week, I should say.
I hear you. Be safe.
Have a good one. Thank you.